entering into the topic, I just want to know that what is your opinion about depression? You can just generally you can say that what do you think about depression? Anyone can communicate to me.
Prolonged sad mood.
Yeah, very good. You hit a proper point at the very beginning. Yes, a prolonged sad mood. Yes, good. And also thank you. This is Divya. Okay, Divya. Thank you, madam. Thank you. Okay. So, as Madam said, depression is a prolonged or consistent or constant sad mood. Actually, depression is a mood disorder. First, there are varieties of disorders: anxiety disorder, personality disorder, mood disorder. Okay, and neurological, psychotics, and neurotic. And neuropsychotic, there are lots of things out there in it. Okay, so as concerned with depression is a mood disorder. When there is a very low mood, then we enter into depression. So mood is not a simple constituency. Mood is a very important aspect. Why? Because I'm not just a psychologist, I'm a psychiatrist also, so I would be explaining both. That's what will give you the complete picture. If I just talk only psychology, it will be just a text. Like if I talk the neuroanatomy and from the brain, then it will give you the perfect text for you. So what happens in our brain? We have frontal lobe and prefrontal cortex. So this section, especially this front section, is responsible for thinking and working, planning, organizing, coordinating, and recollecting the memory. Underline the word, if you are making notes, underline the word recollecting memory. Okay, this is the area which recollects the memory. All of us know that mild to moderate depression we would have gone through. Even I too had gone through depression, but not too much. We'll be discussing the types of depression as well. So when there is a depression, what happens? The recollection of the memory is just stopped with one particular memory or one set of particular memory. So when that happens, only that mood swing happens. That means, for example, if there is a swing that the kids play the swing, no? When there is in the swing, if anyone is keep pushing it, it will go and come. Or the kids will just move the legs, they sway the legs according to the air velocity, so that the swing will go and come. Like that, this one particular stuck recollected thought or a memory, it will make you have the mood swing. When you find that you are not able to do anything, as madam said, that you find sad about yourself, or when you find that you are really unworthy, or you are kind of guilty, you are in a deep guilty, these are all the fundamental feelings which gives you the depression. So we'll be seeing the symptoms as well, but I'm telling the fundamental feelings: feeling guilty, feeling unworthy, okay, and feeling always irritated. These are all the factors beneath the mind, beneath the brain. That means where you're working here is the reason for mood disorder. That means we call depression. So as in you can see the screen, in common man language, we call it as the common man. For example, I know that all of you are not only learning for you, also learning to help your clients, right? No? So that's why I'm trying to give you a complete picture for all of you, that it's not just psychology, psychiatry, and neuroanatomy, and also counseling. It's okay. So I'll give a combined way. So when you meet a client or a patient, if you ask that, okay, what do you mean by depression? Means they will tell these symptoms: that I'm feeling very uncomfortable inside, not feeling fine mentally. Isolation, that means I feel like being alone. I don't want to mingle with the people. I don't want to talk to the people. My mood is changing. My mood is not fine. And I feel unworthy. The word unworthy, you can underline that. When they say the word, these are all the things, through your experience of giving counseling and treatment, you will come to know this. When they use the word unworthy, there are lots of attributions behind it. So these are all the keywords for you to know from the patients. So when you hear unworthy, then you have to suddenly shift into psychoanalysis. You know that Sigmund Freud psychoanalysis. You have to shift into there. Then you have to start thinking in psychosexual development and death fear, rage fear, death, and persistent irritable mind state. So these are all things also you should consider, and your questions with them should go in that way, because anyway you are the therapists going to introspect with the patients. So you have to, they will, one more thing also I'll tell you, see that when people are in anxiety, when they come to you, you need not to talk more, they will talk more to you. Just one question if you shoot, they will tell everything. But when people come with the depression, then you have to pull the answer from their mouth. You have to, as much as questions you should ask. So unworthiness, when these words, when they use, then you have to enter into all this, you know, that the fundamentals of Sigmund Freud and behavioral theories, these are all fundamentals. From there you can take it. The next, as per psychology, now we'll enter into the philosophy of psychology. So depression is a mood disorder. It causes a persistent feeling. Just a minute. Yeah. So mood disorder that causes a persistent feeling of sadness and loss of interest. That means you don't have a motivation. You suddenly the motivation absconded from your mind. You feel that what I'm doing, should I do this? Why should I do this? These are all the questions constantly will be repeating in the mind. So why? Because also it's called major depressive disorder or clinical depression. I'll come back to that anyway. It affects how you feel. How you feel is matter, because depression is a result. Depression is a result. Depression does not just happen one day or 2 days. Until otherwise, you have a clinical, other physical problems are there, like thyroid or menopause or any other surgeries or medications. That, yeah, depression is possible. But otherwise, the depression does not just accumulate in one day. It has lots of attributions behind. So investigation is very important. So now we have to start with the way how you think and how the way you feel and behave. All these interrelated. You think, you feel, and behave. So unfortunately, if they have any kind of aberrations or distortions or perceptual illusion or perceptual delusions, so what happens? This that means, understand this: think, feel, behave. In this three, it's like it will work like a loop. It will work like a circle. In any one area, if aberration or distortion or a delusional thinking is there, then it leads to the variety of emotional and physical problems.